While the training and education of healthcare professionals becomes much more professional, it is vitally important that academic health science centers and other education providers address the professional development needs of their faculty.
I think some of the key issues for us in faculty development are that we need to have faculty development that is relevant to the needs of our faculty, that fits in with their programs, and that is trying to drive something that is new and appropriate in terms of our curriculum.
Anybody who is there normally can be your supervisor. By and large,
We need to make sure that we are relevant to people's needs. We are not just providing lectures or sessions where people sit and listen to somebody talk, because that doesn't meet their needs. We actually need to be working with people. We need to be observing them, applying what they've learned and giving them feedback on that. I think that's critical.
Faculty development programs can be an asset in recruiting and retaining teachers as they offer valued professional development opportunities.
My concern is that there's a lot of paperwork.
There is evidence that in most countries, educators of health professionals are insufficiently prepared as teachers and trainers, even though their clinical knowledge and skills may be good. Effective teaching influences the performance of students, and it is therefore critical to recruit educators with the right competencies.
The type of competencies needed to make a good lecturer would be that they are up to date with current knowledge, have good teaching skills, and are able to deal with students in a professional and supportive manner.
Strategies and formats of faculty development can vary widely as long as they are adapted to the specific needs of the country or institution.
is Natasha around there? You'll have weekly contact with us and other senior staff in the faculty by teleconference.
They can be work-based or classroom-based, face-to-face, via the internet or tele-video conferences, self-learning, mentorship, and communities of practice, or a combination of all of these.
I certainly do think there should be programs for mandatory faculty development. Again, I repeat the fact that people complete a degree in one of the health sciences. They then are prepared to go and practice in that specific area. But that doesn't mean to say that they're prepared for academia in terms of teaching in that subject or research in that area. So I would like to see more courses available for staff in terms of developing their teaching.
Policymakers should be aware that making faculty development programs mandatory will entail important cultural and organizational changes for most education institutions. Faculty development should be promoted as a tool for improving the performance of education programs in terms of their quality and relevance. One way could be recognizing or rewarding faculty.
Recognition and reward for faculty is critical. For any institution, we know that people thrive when they're recognized and rewarded. And it's no less true in a health science faculty, and particularly because as academic institutions, we struggle to meet the kind of salaries that you can get in private industry, for example. So we have to provide other things to people in terms of incentives. And that reward and recognition is an important part of it.
World Health Organization provides guidance to member states on how faculty development gives added value to the teaching and clinical skills of future health professionals. Recommendation 1. Health professionals' education and training institutions should consider designing and implementing continuous development programs for faculty and teaching staff relevant to the evolving healthcare needs of the communities. Quality of the evidence, moderate. Strength of the recommendation, conditional. Recommendation 2. Governments, funders, and accrediting bodies should consider supporting the implementation of higher education policies for mandatory faculty development programs that are relevant to the evolving healthcare needs of their communities. Quality of evidence, low. Strength of the recommendation, conditional. Recommendation 3. Health professionals, education and training institutions should consider innovative expansion of faculty through the recruitment of community-based clinicians and health workers as educators. Quality of evidence, low. Strength of the recommendation, conditional.